So in this explainer, we're going to build a practical guide for managing hereditary gastrointestinal cancer risk. And we're doing it by drawing on the very latest clinical guidelines from the European Society for Medical Oncology. This isn't just about facts and figures. It's about creating a real roadmap for your health. Let's dive in.
You know, it's a question so many of us have asked ourselves. Does cancer run in my family? And man, it can bring up a whole lot of uncertainty. You might know an aunt or a grandparent had cancer, but what does that actually mean for you, for your health, right now? It can really feel like you're trying to navigate in the dark.
But what if you could take all that uncertainty and turn it into a clear plan of action? Well, that's exactly what we're going to do here. We're going to explore the science behind genetic risk, see how doctors pinpoint it, and most importantly, walk through the proven steps you can take to manage it. It's all about trading that worry for a real proactive health strategy.
Okay, so to really get our heads around this, let's zoom in on the most common hereditary colorectal cancer syndrome out there. It's called Lynch syndrome, and honestly, it's the perfect way to understand how we can decode the clues that are hidden deep inside our own DNA.
So what is Lynch syndrome exactly? Well, at its core, it's an inherited condition. It's caused by a mutation in what are called mismatch repair genes, or MMR for short. Now, the best way to picture these MMR genes? Think of them as your body's own personal spell checkers. They're constantly buzzing around, scanning your DNA and fixing the tiny errors that pop up when your cells divide. But in Lynch syndrome, that spell checker is faulty. It lets mistakes slip by, and over time, those mistakes can build up and, well, that can lead to cancer.
And while you might think it's super rare, Lynch syndrome is actually more common than you'd expect. It's responsible for up to 3% of all colorectal cancer diagnoses. That makes it a really significant, and here's the key part, an identifiable cause of hereditary cancer.
Now, this is absolutely crucial to understand. Lynch syndrome isn't just about the colon. That faulty spell checker can cause problems in cells all over the body. I mean, just look at these numbers. It shows a massively increased lifetime risk for a whole range of cancers. We're talking colorectal, endometrial, gastric, ovarian. Understanding this broad risk is everything when it comes to managing it the right way.
Okay, so we've got a handle on what it is. The next big question is, how do you even find out if you or someone in your family has it? Let's walk through the diagnostic roadmap that doctors follow, taking us from just a suspicion to a crystal clear confirmation. All right, I know when you first look at this, it seems, well, super complicated, right? It's the official flowchart that doctors use, and there are a lot of arrows and boxes going on. But trust me, the logic behind it is actually really simple and straightforward. Let's break it down.
That whole complex chart really just boils down to these 3 steps. It all kicks off by screening the tumor itself, looking for clues that genetic spell checker just isn't working right. If they find those clues, they dig a little deeper to make sure it's not some other issue. And then finally, a simple blood test, what they call a germline test, confirms whether that faulty MMR gene was actually inherited.
And the way these first tests work is actually pretty cool. Think of IHC like this. It's a visual roll call. It uses a special stain to literally see if those spell checker proteins are showing up for work in the tumor cell. MSI, on the other hand, looks at the aftermath. It checks the DNA for a ton of typos. That's the telltale genetic fingerprint that a broken spell checker always leaves behind. All right, so a diagnosis is confirmed. And this is where everything changes. Seriously, this is the moment where knowledge becomes power. You're not in the dark anymore. Now, you have a clear, evidence-based action plan to take control of your health and drastically lower your risk.
And the results of being proactive? They're just staggering. For people with Lynch syndrome, the guidelines show that regular colonoscopy surveillance can slash the mortality from colorectal cancer by up to 72%. Just let that sink in for a second. That's not just some number on a page. That's the power of having a plan.
And here's the thing, this isn't some generic one-size-fits-all plan. It's totally personalized. The specific gene that has the mutation, whether it's MLH1, MSH2, or one of the others, is what determines the exact recommendations for when you should start screening and just how often.
You can see that personalization right here in this table. If someone has a mutation in the higher-risk MLH1 or MSH2 genes, colonoscopies should start early, at age 25, and they happen every 1 to 2 years. But for those with MSH6 or PMS2 mutations, it's okay to start that surveillance a bit later, at age 35. It's a clear schedule, all based on your specific genetic makeup.
Right, and because the risk isn't just about the colon, the plan has to cover all the bases. For women, the guidelines recommend starting annual gynecological screenings between 30 and 35. This is to keep a close eye out for both endometrial and ovarian cancers, and it includes an exam, an ultrasound, and a biopsy.
And it's not just about watching and waiting. There are really powerful preventative options on the table too. This quote from the guidelines points out that for women who are done having children, preventative surgery to remove the uterus and ovaries is a serious option to consider. This one procedure can massively reduce the risk of gynecological cancers, making it such an important conversation to have with your doctor.
And you know what? It turns out your day-to-day choices really matter too. The guidelines are super clear. Things like smoking and obesity can actually increase cancer risk even more for people with Lynch syndrome. So the recommendation is pretty straightforward: avoid smoking and maintain a healthy weight. It's all part of the strategy.
Okay, so let's pull all of this together. We've really gone on a journey here, haven't we? From that one simple nagging question about family history all the way to a detailed, personalized, and honestly, life-saving action plan.
Look, if you take away just one thing from all this, let it be this. Finding out your genetic status is not about getting bad news. It's about getting the information you need to take back control. It transforms that vague, anxious feeling into a clear, manageable plan that lets you live your life proactively and with confidence.
And that really brings us to the final thought here. The first step on this whole journey is just starting a conversation. So if any of this struck a chord with you, think about it. Based on everything we've talked about today, what is one simple, informed question you can bring to your doctor at your next visit? Thanks for joining us.